Hi, welcome to Voices of Somerville. It's a program of the Office of Somerville Commissions, which is part of the Health Department for the City of Somerville. We are a commissions-driven organization doing community outreach and helping the community connect. So sit back and enjoy today's show. I'm very glad to have today our friends from the Indian Circle for Caring program, and we have the founder and executive director, Girish Mehta. And we have the Community Outreach Director, Chetan Mapani.
Thank you for having us.
Thank you so much for coming. And I'm really excited about this program. It's really creating a service just itself towards the Indian community, but I'm also wanting to hear more about sharing the entire model. So let's start with the founder and hear a little bit about what is the Circle of Caring.
Sonja, what happens is that all of us tend to be very busy in our lives with the personal responsibilities, family responsibilities, and professional responsibilities we have. In case any one of us have urgent and emergency situation come their way, such as serious sickness, hospitalization, family crises, accident of some sort, or even death of loved one. In those situations, the person and the family going through those difficulties find it sometimes hard to manage that situation, since they may or may not have the experience in that area, they may or may not have the time, or how to go about it in a variety of other reasons. So our organization is a volunteer organization currently designed so that we can reach out to our community members and provide the support in the hour of their need in the situation I just outlined. This is something we started 7 years ago when we realized that although there are a number of organizations in our community that serves the need for social support, religious support, professional networking, etc., there was a missing item, which was when somebody is going through difficulty, what kind of support and help they can count on. People who have learned about it, people who can provide the support, hold their hands, and get them through this difficulty. So that's what we started with in 2007, August.
And just to kind of look a little bit closer, like what made you think of it that year? What was, did your neighbors ask for help? What was the starting point?
Sonja, what happens in our lives is that we have a lot of experiences that we have. Most of us, most of the time, see that pass by. However, as I was planning to retire and trying to be productive about something meaningful, where at the end of the day I can feel good about my accomplishments or contributions, we evaluated a variety of scenarios and possibilities. And we were fortunate that we were able to get a lot of our community leaders to come in a brainstorming sessions, meetings, and talked about what is available and what is missing. And out of that, we emerged with this idea that if we have volunteer-based organization that is fully focused on service only, that would be beneficial to our community. And then there were a number of experiences in life that brought the point home, seeing other people going through difficulty, when it was very easy to see that if there was an organization, the problem could have been easier handled. So all of these things came together back in summer of 2007. So by August of 2007, we were able to formulate this program. And Chetan began to help us as a director of community outreach. And there were a couple of other key individuals who started to build a core group. And then we were able to establish our organization in a very meaningful way. We are very fortunate that today we have over 3,000 members. We have over 200 volunteers who have said that they are willing and able to help us with their specific skills, specific window of time per week, so we can reach out to them and they can become a resource for ICC to help the community members.
What did you think when you first heard of this?
I was very touched and I was very excited to participate because there are a couple of things this organization does very well. It does not include any politics. It touches human heart. It really means something to every individual, and it's really a necessary thing and important for everyone's life. And that really motivated me to say, this is where I need to be starting, 7 years ago. And today, like, we are in full-fledged, growing leaps and bounds. When I say growing, meaning in terms of members, in terms of servicing, in terms of getting volunteers. And not just that, but also transforming our knowledge, our model to other organizations as well. And he's taking a true leadership role in that position.
I think it's fantastic. I was really glad to be a part of the small Nepali community that was coming up with a small piece of what you have established, which was just hoping that the community, when something happens, can hold on to their culture and their religion while using American services. And so we were able to just make a couple brochures that helped to steer in 2 topics. And then the idea of the volunteer model was going to be a future. But I think being able to see how the Indian Circle of Caring is establishing and rolling out very diverse as well as many members that are going to be giving their skills and I think, in the end, just their care.
Absolutely.
Right? I think that's what's lovely about the model you're sharing.
Absolutely. And one thing I do want to emphasize, when we say members, meaning just community fellows, it doesn't require any fees or anything like that. They are just, we know who they are, we have the information, and they become our eyes and ears.
And it's really not this obligation that on Tuesday you must give. It's, here we have this need, who can give?
Absolutely.
Is that right?
Yeah, except there is some modification to it. Our volunteers have said, based on their own personal situation, professional and family, that they are available to help us with 2 or 4 hours a week.
Right.
They are available at a certain time of the day. They told us where they live. And based on that, they say they are prepared to travel X number of miles from their home, which is convenient to them and also productive for them. So they have identified their availability to us, which allows us so that when a request comes in, to match with the available resources and make it easier for us to reach out to the right people if they are available at that specific time, assign them the particular task, and help the family in need.
So let's, for example, you have a Jain family that is struggling with a situation in Lynn, for example. So would you try to match another family who is also from Jain that can give some support, whether or not it even has try to match people by culture, or is it really does not matter? It's the whole culture and religion is set aside for, you just need support.
Exactly. If you look at our logo, we include the flag of India and circle around it, because we wanted to emphasize the fact that regardless of our own religious differences, language differences, food differences that we may have, we are at the end of the day united. And therefore, when the volunteer steps up, they are not discriminating between a particular language speaking person, particular geographic area, or any such. They are willing to say that we are going to serve anybody in Indian community, thereby making us stronger and be able to reach a higher level of performance as we serve them. The second question you asked is also important. Give you an example. We had a woman who was diagnosed with a possible breast cancer about 3 years ago. When she heard about it, she was in panic because her personal situation was such that being able to get through this difficult time would be awfully challenging for her. It turns out that she was a divorced woman. Her ex-husband lived in Virginia. She had one able son who is working in Washington, D.C., and she had two 40-year-old adult children in house who are disabled. Now, for her to take care of those 2 children and get through this serious sickness was going to be challenging. So when she reached out to us, we were able to understand her needs, and from that moment, biopsy, surgical procedures, 5 chemotherapy, 35 radiation treatments, and all the doctors' visits in between, when they took place, we were able to put together a team that could support her for the transportation, advocacy in front of a physician, and all the support she needed until she was declared cancer-free following December. So the idea was, in that case, 9 or 10 of our volunteers together served the need that was necessary. In addition to that, Sonia, our model is that we don't say we have to be doing everything ourselves. We also reach out to existing other organizations. In that particular example, we reached out to American Cancer Society because we had already pre-established contact and relationship with them. So when this situation happened, we were able to get their resources to complement our resources, and together we became a single source of relationship with the client and be able to provide the support necessary.
That's lovely. I've experienced that only within my own religious community. As Quakers, we immediately put a Quaker committee of care around somebody, but it's really with internal, whereas to be able to do it so externally, to do to a stranger that is just a community member, and all you're saying is, I'm there for you so that you can take care of what you need to do. And I think that's the beauty of the entire model. And so you're doing outreach into the community. What would that entail?
So outreach entails basically participating in various community programs, advocate, people, educate people about ICCs and their initiatives. We try to go to even religious communities, just to explain them what as a ICC that we do and how we can help them, because it's in their benefit. So we try to do, participation in the shows, booth, maybe like there were cases where there are Indian New England Medical Association group where we would provide, some 20 minutes of speech on healthcare proxy. That's one of the initiatives that we are doing. So there are a lot of those things that we try to do.
Let's go into that. I think that hopefully everyone in the audience has got a good idea of the program and are excited about how can they get their hands on participating. So let's talk about some of the programs that you've actually been working on.
So Sonia, as we began the process of formulating the organization and began to prove it, we quickly became aware of a couple of things. One is that our community recognized the importance and the need of it, and they were appreciative of our presence in their lives. Besides that, we realized that volunteering efforts by itself are most important things we need to do, but we can complement it by other initiatives that go with it. So we realized by doing some research back in December timeframe of 1997 that 80+% of our community members, and the numbers are not too much different regardless of where you go, are not even aware of what healthcare proxy is, how important it is to do, and how to go about getting it done. So we said volunteering is our main thrust of activity, but we need to complement that by some signature initiatives, such as healthcare proxy, some health seminars, arthritis exercise programs, things of that nature. So we began to do that. And the third aspect of what we do is to provide a lot of information on our website, because certain things can be self-study. If you have a question about it, you can visit the site and learn about it on your own without needing a volunteer to hold your hand.
Right.
So 3 aspects of what we do. One is the volunteering, second one is healthcare proxy, another initiative, and third is web-based. Let me briefly mention to you the web-based resources that we have. If a family is taking care of an elderly person at home, it becomes challenging. Sometimes one may not know what are the resources available. So there is a home health guide as a result of the research at MIT that was published. And we were very fortunate to provide that information on our website. So anybody who is taking care of a person at home, who is looking for resources, some guidelines and some information, they can reach out to our website to help that. Secondly, you are so young, you probably would not have to deal with it for many years. But a person like me who is approaching Social Security age, dealing with Social Security, Medicare, Medicaid becomes a very difficult thing to do because of the complex regulations and things that go along. There is a person in California who wrote a book saying, how do you map the maze? And we were very fortunate that he allowed us to publish this entire book on our website. So on our website, we have an increasing level of resources that we are on the process of having it and building even more. Now when we come to initiatives such as healthcare proxy, what we said was we need to inform that there is a need, educate, because information by itself, we hear a lot of information over the media and the broadcast media, print media, what have you. But a lot of things get put aside. So now, in order to make it visible and important to the listener, we say we need to educate them. So we now conduct healthcare proxy presentations and workshops, whereby we have a chance to spend an hour on that topic alone. And by that, attendees learn about it, understand the importance of it, and be able to implement that for their own situations. We have done that in 9 different states in the United States now, even though our physical presence is not in California or North Carolina, but we still conduct that because there is a community need. And if the situation were to arise, in our case, it's Somerville TV, we'll be glad to have a separate session to talk about healthcare proxy. And that way other individuals, the entire Somerville community can benefit. So we have done those kind of things here as a part of the initiatives we have taken.
That's lovely. And I think, I know that the whole movement for healthcare proxy has been growing, but no matter how much it's growing, it's still a small number of people who have taken the first step, and it sounds very foreign. And then if you start thinking about it, there's a lot of decisions to be made. So it's very good to have such a wonderful organization willing to be a part of the process.
So on our website, there's a flyer that talks about what it is, why one should do it, and how one can get it done in the privacy of their home without any cost. So when they go to our website, few simple steps would allow them to have an access to this document called 5 Wishes. And this is a document that is legal in 42 states in US. Over 15 million people have used this. So it's very well proven. Very simple to use, does not require a lawyer, doesn't cost you anything, and you can choose your answers and choices and make multiple choice questions or your preferences, or even handwrite your choices within that. And that way you can get this done. So at an opportune time, we may take more time to talk about this single topic.
Absolutely. I think that we definitely can have more opportunities to break apart the story. And so I want to talk a little bit about like what you have been able to do with different. Do you have like a story of various families that you might be able to kind of share to show
Absolutely.
Whose lives have been helped by from our ICC?
Yes. So when we started this organization, most people's perception was this organization is very needed for gray hair, no hair people.
Yes.
Because the concept is young people are not vulnerable. They are doing well. They don't need the help.
Right.
And over a period of time, with over 200 plus families we have now helped, the mold is broken. The youngest person we have helped is 2 days yet to be born.
Right.
And the 94 years old. And if you look at the demographics, there is all age group, all socioeconomic group, very poor to multimillionaires, highly educated PhDs and medical doctors to non-educated people. So the point is, in a community, an emergency and urgent situation may come our way regardless of who we are. And then to be able to help them is very, very meaningful. And over this period of time, now we have verified the value of it from the receiver's point of view. Every time we finish working with a client, we ask them what is their feedback in writing. And we have a catalog of that. And that shows how valuable it is felt by them on their own. And we are now repeating that story over and over again. For example, I'll give you a couple of examples depending upon the time we have. The example I gave you about a woman, we went through breast cancer treatment and diagnosis and being declared fine is one of them. Second example is there was a phone call we received saying a Indian couple from Singapore is flying into Boston as we speak. They are coming in distraught because their 23-year-old son, who is a third-year student at a local university, in the first week of being at school in the third year, has committed suicide. And the parents are flying in. Now, obviously, the parents live in Singapore. They have no connections, no understanding of what needs to be done, how to go about getting this done through a very difficult time. So we were able to help that family over 2 weeks period in making sure their accommodation, food is taken care of, meeting with the university faculty and students, police department, and understanding what transpired, so it gives them some relief, not completely, because losing of a young son is very difficult at any age. And on top of that, planning for the funeral and cremation, that was necessary part of things. So we supported that family. And in that case, they are financially very well-to-do, highly educated, but then in their case, they had no idea of how to go about solving the issue, addressing the problems here in US. The another example is that a grandfather living in Chennai was distraught because he lost a son. But the son's son, 2 grandchildren, lived in the US, and one in North Carolina and one in Boston. So grandfather was in the best of health, and he traveled here because grandchildren thought that grandpa would need change of scenery, seeing a new great-grandchild would be useful. All of those reasons he came. He had a wonderful visit in North Carolina, came to Boston area, and for some unknown reason, he developed septicemia, which was a serious disease. He was in the ICU at Tufts Medical Center for quite a while. We supported the family while he was sick. Unfortunately, he passed away. The doctors couldn't do anything for him. And at that point in time, we needed to have his remains transported to Chennai at a reasonable cost in a prompt way, because everybody in India had seen him go without any health issue. And now all of a sudden, he is coming home in this way. So we were able to help that family. So the stories like this are many, over 200 of them, and they are all gut-wrenching. But the beauty of this, our being there, is that we make a small difference in the family's lives when they are going through such a period. And they always remember the volunteers that helped hold their hand, the people who supported them, the organization that has made this possible.
Can you tell me, what do you think is a possibility? So we've got the Circle of Caring, and we've got 200 families who have had support. And what do you think, knowing that you're sharing the model, what do you think that our community can be in 10, 20 years if we've really started to see the model spread?
I think it brings community very close because volunteers are growing by leaps and bounds. Members are becoming more aware of that there is somebody who they can lean their shoulder to. So that awareness is growing. And we are making more effort also to make sure that people are aware of that, there's always someone who cares for you. And so don't hesitate to ask for help.
And so it's like the growing of our neighbors to
Absolutely.
A larger circle.
Larger circle of.
And how do you think that this will translate? I mean, you've already helped people in Chennai and Singapore. And of course, we've got a large, the by country population. So do you see this as a possible hope for the future?
Yes. Over the last 5 years, as we have traveled in various parts of the country and met with the leaders of Indian community there, formal organization leaders or individuals, the message has come loud and clear that this is a wonderful idea, a great model, we can follow it and we can replicate it. As a result, for example, there is another organization called Seva International in Houston, with its presence for 10 years, doing different kind of services work, realized that they needed to do something for the community in Houston. They came to us over 2 years ago And last April, we inaugurated a program called Family Services in Houston, which is a replica of what we do here. We shared our know-how, we trained their volunteers, we held their hands so that they were ready to start the program in last April. And now the idea is to be able to multiply that at different places. And our attempt is twofold. One is, if there is an existing organization who has the heart to do something like this, we'll guide them and help them. Secondly, if there is a community members, there are 3 or 4 individuals who say this is something we need to do in our community, even though they may not have a formal organization yet, we will start ICC chapter in that location. So we can take either of the 2 approaches depending upon a particular situation at a particular location. So our attempt is to multiply this and get the benefits to our community. And we also meet with other community members. For example, 3-4 months ago, I met with a Jewish community temple and their caregiving people. Try to understand what it is they do. Try to share with them what it is we do. We learn few things from them, they learn few things from us. So anybody that can help a human being in need is something that is closer to our heart, because that's the reason for doing it. Although we started where our heart is, because we have a similarity of culture, commonality of values, commonality of habits, so that we are comfortable and the client is comfortable reaching out to us in terms of confidentiality, in terms of trust, in terms of values. So that's what we have started with. But we think that this model could work well. And we were very fortunate that in 2010, we were invited at the White House for the kind of model we have in terms of serving our community by ourselves without government intervention, without government funding and money.
I think that's very lovely, and the amazing opportunity that we have to really work at the personal level, but seeing how it's expanding. And what do you think about the idea of, like, it's formed around the idea of caring around crisis, but you're almost the midwives to help all this birthing of new hope here.
Absolutely, and the good thing we have is most of our volunteers, this organization wouldn't have been successful without Mr. Girish Mehta and the volunteers that we have today. And believe me, we are there to help support any other community, or to provide sort of guidelines also to establish a similar model as Girish Mehta mentioned before. So we definitely look forward for those challenges more.
So we have about 1 minute left. What would you like to share with our viewers today about the hope that you've been sharing?
2 things that are important to the viewers in Somerville. It turns out that I started my Boston stay 45 years ago in Somerville, so it is my coming home too. I started my I arrived at Somerville, Waterhouse Street, in August of 1968, and I went to Tufts. So I spent my 2 years at Tufts on Medford campus, a couple of miles from here. So the message to the Somerville community is this. First of all, if you have not done and prepared healthcare proxy, visit our website and learn what it is, how important it is. It is important for every one of us who is over the age of 18. It applies to every one of us because we do not know what the future will bring. So that's one message. And the second short message is that for the immigrant communities, TB is a hidden disease.
Tuberculosis.
TB. Yes. And we had just finished a project working with Department of Public Health in understanding the risk we are facing in Massachusetts as a community. There are over 200 cases. So it's not a disaster, but it's something we need to be aware of. So on our website, there is a mention of TB initiative, solution, approaches to it. So those 2 things are the most important, and we encourage your visitors to go to our community resources and use those 2 sections at least so that they can benefit directly as a result of this conversation.
Well, thank you so much for coming to Somerville and sharing about ICC. Chetan and Girish, I appreciate it so much. And there's so much more on the website, so go to ouricc.org to learn more about all of the resources available, the book that you can look at, and the handout. So watch for us on Facebook and our blog. We'll be sharing a lot more about this program, and we'll see you in the next program. Thanks for joining us.